Let's talk about the Cancer Awareness Month slated for October every year. Breast cancer has been reported to be the most common cancer in women worldwide, both in developed and developed countries. Advocacy from improved awareness continues to grow since early detection is key to breast cancer control. And the World Health Organization recommends early detection strategies for low and middle income countries. Well, let's talk about this now. Joining me for discussions is clinical oncologist Dr. Kehinde Ololade. Thank you very much, Doctor, for joining us at this point. Well, Nigeria is 60 years since independence. Yes. What do we have to celebrate in terms of management and infrastructure for combating breast cancer?
Well, thank you very much for this opportunity. If we compare where we're coming from to where we are, we've actually had some development. By the 1960s, there was no cobalt machine, there was no cobalt treatment machine. The number of oncologists in Nigeria were probably maybe one or two, but right now we have close to 100 oncologists when we're comparing over the 60-year period. But when we now compare with other nations of the world or with other middle-income nations or low-income nations, and also of high-end income nations and the WHO standard, where it's expected at least we have one radiotherapy machine, for example, for 1 million people, whereas in Nigeria we have less than 10 for a population of over 165 million. So if we compare from where we're coming from, we've actually left where we were, but compared with where we're supposed to be, there's still a bit to be desired.
And of course, if we look at the earning power of many Nigerians now, that is also an issue. But I know for you medical practitioners, there's also the concern of lingering religious and cultural, barriers that prevent people from presenting cases early enough. Have we made progress in that regard?
Well, actually, one of the greatest challenges we've had is the fact that the understandings of a lot of people concerning cancers and the causes is a major challenge. One of the things we've seen is that a lot of people feel that it's an arrow from evil powers and all that has been the result. And a lot of people have explored alternative methods of treatment for this, such that as much as possible, because of the snag and the stigma that follows the diagnosis of being a cancer person and all that, a lot of things go on that prevents people from actually exploring the conventional medical practices and available facilities that we have in the country.
But what's fueling stigma associated with breast cancer? It's not like it's contagious.
Well, the factors that we've identified, where some have been religious, some have been is not my portion, some have been conditions of the level of enlightenment when they notice that they have a lump, and instead of them actually exploring ways to get it sorted out and all that, they will rather ignore it initially. And one of the things also we observe is that there's a circle: first denial, then later acceptance, then sometimes they even have aggression, then also they will explore alternative treatment.
So early detection is still the way to go?
Well, actually,
and there's no age, or is it safe from 40 to just start, making necessary tests?
Well, the cost of the test is really something that a lot of people might not be able to afford. Because of that, the early detection with basic things, self-breast examination, it's enough. And early detection is the key to survival.
Right. Dr. Kehinde Ololade, thank you very much for your contributions on the news.
Yeah, well.